If you think you may be pregnant, make an appointment with your family doctor. The doctor will ask you to do a pregnancy test. You will pee into a cup. They will have the results within minutes. If you have a positive pregnancy test, the doctor will refer you to a healthcare provider who will care for you throughout the pregnancy and for the postpartum period. Wherever you go for prenatal care, you have the right to have a trained interpreter who speaks your language at all medical appointments. If an interpreter who speaks your language is not available, a telephone interpretation service will be used. Your healthcare provider will make arrangements for the interpreter. Some women in Manitoba are entitled to receive money from the government during their pregnancy. Speak to your settlement worker or healthcare provider about whether or not you are eligible to apply for this program. Babies in Winnipeg are delivered at 2 hospitals, downtown at Health Science Centre's Women's Hospital or at St. Boniface Hospital. Which hospital you deliver at usually depends on hospital capacity. Your healthcare provider will tell you which hospital to go to. If you have a midwife, you may also be able to give birth at the birth center or at home. Healthy Start for Mum and Me is a program for expectant and new mothers in Winnipeg. There is a special group for newcomers to Canada. The people who lead this group will arrange for an interpreter who speaks your language to be at the group with you. You can meet other mothers-to-be, get tips about nutrition and health during pregnancy, and learn all about having a baby in Canada. Dads are welcome too. This group offers on-site childcare for children 5 and under. They also serve snacks and give bus tickets if needed. You have the option of attending the program in English at other locations. Talk to your settlement worker or healthcare provider about the locations and times of these groups. Your healthcare provider will also ask you if you would like to be visited by a public health nurse during pregnancy and after your baby is born. During the prenatal period, the public health nurse will come to your home and offer information and answer any questions you have about pregnancy, labor, or delivery. The public health nurse or your healthcare provider can arrange to have a trained interpreter present at these home visits too. In Manitoba, midwives are trained healthcare professionals who provide prenatal, labor and birth, and postpartum care. If a woman is under the care of a midwife, she does not need to see a doctor during or after pregnancy. Midwives do consult with doctors or refer their patients to doctors if necessary. If you are interested in the services of a midwife, call 204-947-2422, extension 307, or speak with your settlement worker. At a typical prenatal appointment, the healthcare provider will weigh you, check your blood pressure, listen to the baby's heartbeat with a special instrument, measure your belly, ask questions about how you're feeling, talk about tests that may be done on the fetus or you, let you know about any necessary appointments for an ultrasound or other tests, and offer other information about pregnancy, labor, and delivery. You have the right to ask questions too. You will probably have blood and urine tests at every prenatal appointment. Your service provider will let you know how often you should come in. Appointments are usually once a month for the first 7 or 8 months, and then once every 2 weeks until delivery. At around 20 weeks of pregnancy, you will have an appointment for an ultrasound test. The technician doing the ultrasound will use a machine to look at the baby and take pictures for your service provider. You will also be able to see the baby on the screen, although the technician may wait until the end of the test to show you the screen. The ultrasound is used to estimate the baby's age and growth, the position of the placenta, and whether you have enough amniotic fluid. You may also be able to find out the baby's sex at the ultrasound. The ultrasound does not hurt. Your partner and other children may accompany you and will have a chance to see the baby on the screen too. As you get closer to your due date, there are plans that must be made. You should pack a bag that you will take with you to the hospital. You will need the following: your Manitoba health card, comfort items for while you are in labor, personal items and clothes, baby clothes and a baby blanket, and an infant car seat. You should decide who will take care of your other children before you deliver your baby at the hospital. When labor starts, in general, you should stay home until your contractions are coming every 5 minutes and lasting 1 minute, and this has been happening for 1 hour. This is called the 5-1-1 rule. Make sure to have a timekeeper or clock on hand to time your contractions. Make sure you know how you are going to get to the hospital when you go into labor. Will you take a taxi, the bus, or will someone drive you? At the hospital, you will be placed in a private room during delivery, and a doctor will deliver your baby. In most cases, you will have choices about medications to reduce pain during delivery. You are allowed to have 1 or 2 support people with you in your hospital room during delivery. Both hospitals are able to provide care during emergency complications that may arise during delivery and cesarean births. After delivery, you will share a room unless a private room is available. Nurses teach you how to breastfeed and care for your newborn baby. You may have visitors beginning 2 hours after the baby is born. Most women go home with their babies between 24 and 48 hours after birth. You must have an infant car seat at the hospital in order to be released from the hospital, even if you are taking the bus or a taxi home. Check the expiry date on the car seat and make sure it is not expired. You should put the car seat together and know how to use it before coming to the hospital. Your healthcare provider can arrange for a public health nurse to visit you at home after the baby is born. The nurse will check the baby's growth, make sure breastfeeding is going well, and give you information about newborn care and caring for yourself. You should make an appointment with your healthcare provider after the baby is born. If you may need childcare in the future, put your name on waiting lists, register online or by phone, and visit the daycares you are interested in. This video has introduced you to the various choices and support services that are available if you are having a baby in Winnipeg. You will receive more information from healthcare providers, support groups, and settlement workers. These people are here for you. Consult these valuable resources regarding any questions you have.